Welcome to another episode from the Veterinary Research Channel. Today, we're diving into some fascinating research from the world of equine surgery and advanced imaging. We'll be discussing a prospective study published in Veterinary Surgery in 2024, looking at positron emission tomography, or PET, in assessing condylar fractures in thoroughbred racehorses after surgical repair.
That's right. Condylar fractures of the third metacarpal and metatarsal bones are a significant problem in these athletic animals, causing considerable health issues and sometimes even mortality. They are thought to result from the accumulation of tiny damage caused by the intense, repetitive high-peak strain during training. These fractures typically run in a sagittal direction, sometimes with displacement of a bone fragment. They can be located within the parasagittal groove or further away from it in the condyle.
The authors point out that finding early signs of these lesions before a full fracture occurs could be a key opportunity for preventing them by identifying horses that are at risk. While standard X-rays can sometimes show early signs, especially with specific views, their ability to detect subtle changes is limited. More advanced imaging techniques have been explored to find additional issues. MRI, for instance, has identified incomplete condylar fractures in a notable percentage of horses in previous studies.
And this is where PET comes in. PET is a functional, three-dimensional imaging method that has compared favorably with other imaging modalities for detecting stress remodeling in racehorses. It's relatively new, especially for imaging standing horses. Initial use of PET in thoroughbreds has frequently shown abnormalities in the fetlock joint. Given how condylar fractures develop, PET could potentially be very useful for prevention, diagnosis, and monitoring after surgery.
Absolutely. This study aimed to look at the findings from using PET scans specifically associated with condylar fractures at the time of surgical repair and throughout the healing process. They wanted to see if PET could detect changes that might have made the horse prone to the fracture in the first place, and then monitor how the fracture and any related issues healed afterwards. The researchers hypothesized that these fractures would show increased activity on the PET scan that would decrease as healing occurred, that other problems would be present in the fetlock joint, that the opposite limb might show a pattern suggesting early development of a similar issue, and that the PET findings would be related to how well the horse recovered and returned to racing.
Let's move on to what they found, their results. They studied 14 thoroughbred racehorses that had sustained a metacarpal or metatarsal condylar fracture and undergone surgical repair. The horses were between 2 and 6 years old. PET scans were performed within 4 days of surgery on both the injured leg and the opposite leg. Follow-up scans were also offered later, around 3 and 5 months after the surgery.
Regarding the fractures themselves, 12 out of the 14 horses had lateral condylar fractures, while 2 had medial ones. 8 fractures were located in the parasagittal groove, and 6 were located outside of it, in the palmar or plantar condyle. Fracture repair was performed fairly quickly after injury for most horses.
On the initial PET scans, increased activity was seen in the expected location of the fracture in all 14 horses. This increased uptake followed a narrow line in 10 cases, while in 4 cases, all of which were non-parasagittal groove fractures, it had a more rounded, broad shape at the end of the bone. The area with the highest uptake varied, sometimes being at the articular surface, sometimes at the cortex, and sometimes away from these areas within the fracture plane. The average highest uptake value measured was 15.2. There wasn't a significant difference in this highest uptake value between parasagittal groove and non-parasagittal groove fractures. They typically didn't see increased activity related directly to the screws used for repair, except for sometimes at the tip of a screw or mild uptake in the soft tissue near the screw heads.
Now, the associated findings are quite interesting. In most horses with parasagittal groove fractures, there was no significant uptake in the condyles outside of the parasagittal groove in the injured leg. However, 3 of these horses did show uptake in the same parasagittal groove in the opposite limb. For all 6 horses with non-parasagittal groove fractures, there was focal uptake in the injured condyle suggestive of stress remodeling in the bone beneath the cartilage.
And importantly, all 6 horses with non-parasagittal groove fractures also showed uptake in the same condyle on the opposite limb. This uptake in the contralateral limb was often more severe laterally than medially, particularly in the hind limbs. In total, 12 out of 14 horses had additional findings in the injured fetlock on the initial PET scan, such as uptake suggesting stress remodeling in the condyles and proximal sesamoid bones, and uptake near the joint suggestive of degenerative changes.
Looking at the follow-up scans, performed several months after surgery, the increased uptake at the fracture site had resolved in 6 of 10 horses by the time of the first follow-up. However, in 4 horses, there was still persistent increased uptake at the fracture site. In a couple of cases, this persistent uptake decreased, while in 2 others, it slightly increased. Interestingly, 2 horses that showed no fracture activity on their first follow-up scan developed activity again on the second follow-up scan.
Additional pathology was also monitored. 4 horses developed uptake near the joint, which suggests degenerative joint disease. 3 of these horses also had persistent fracture activity on their follow-up PET scans. Regarding the uptake seen in the opposite limb, in horses with parasagittal groove fractures who had uptake in the opposite parasagittal groove, this activity resolved by the first follow-up scan. For horses with non-parasagittal groove fractures that showed uptake in the opposite palmar condyle, this uptake persisted or even increased in some cases on the first follow-up, though it generally resolved by the second follow-up scan.
The outcomes are quite telling. 5 horses were retired and did not return to racing. 6 horses returned to racing, and 3 were in training but hadn't raced yet when the data was collected. All horses that returned to training or racing had satisfactory radiographic healing of the fracture before returning. However, in 2 horses that returned to racing, PET still showed uptake at the fracture site after they were cleared based on X-rays.
And 2 horses where fracture activity had resolved initially on PET later developed increased uptake at the fracture site on subsequent scans as training increased. Neither raced successfully after this. For horses that showed fracture activity on their initial follow-up PET scan after surgery did not race successfully, with only 1 exception. Furthermore, none of the 4 horses that developed signs of degenerative joint disease on PET successfully returned to their previous level of performance. 3 were retired, and 1 raced only once at a lower level. In fact, only 1 horse with activity at the fracture site on a follow-up scan raced successfully. Of the 5 horses that did race successfully, only 1 had signs of fracture activity on the initial follow-up PET, and none of them developed uptake suggestive of degenerative joint disease.
This leads us into the discussion section, where the authors put these findings into context. The study confirms that all condylar fractures show moderate to severe increased uptake on PET at the time of repair, which decreases over time as they heal. A crucial finding is that a large majority of horses, 85%, presented with additional problems in the injured fetlock.
And the finding of uptake in the contralateral limb for all horses with non-parasagittal groove fractures and some with parasagittal groove fractures strongly suggests the presence of pre-existing lesions that PET can detect. This reinforces the idea that PET could play a role in identifying horses at risk before a fracture occurs. The study suggests that follow-up PET findings are indeed associated with outcome, as horses showing signs of degenerative joint disease or persistent fracture activity generally did not race successfully.
The study categorized fractures by their location, either in the parasagittal groove or not. The associated pathology in both the injured and opposite limbs seemed to differ depending on the fracture location. For horses with parasagittal groove fractures, it was rare to find stress remodeling uptake in the condyles outside the groove in the injured leg. This aligns with previous work suggesting a lower incidence of palmar osteochondral disease in horses with lateral condylar fractures compared to those without.
However, the picture is more complex. In this study, all horses with non-parasagittal groove fractures had focal uptake consistent with stress remodeling and potentially palmar osteochondral disease at the fracture site and in the same location on the opposite leg. Recent work using CT scans has shown that fracture lines often extend through these types of lesions. This suggests that condylar fractures might originate within or extend through these palmar osteochondral disease lesions, implying a more complex relationship than previously thought and highlighting the need for further study considering the specific fracture location.
Understanding the origin and associated issues of these 2 types of fractures provides insight into opportunities for identifying at-risk horses. In the study, only 3 out of 8 horses with parasagittal groove fractures had uptake in the same groove on the opposite limb. This aligns with prior studies that found bone marrow lesions or linear fissures in the contralateral fracture site in only a minority of horses with catastrophic lateral condylar fractures. This suggests that disease confined to one side is common in horses with parasagittal groove fractures.
Interestingly, increased uptake within the parasagittal groove was only seen in the groove with the fracture or the one on the opposite side of the body in this study. Data from a large number of racehorse fetlocks scanned with PET shows that uptake in the parasagittal groove is estimated to be present in less than 5% of fetlocks, which is much less common than uptake in the condyle further away from the groove. These observations suggest that increased uptake in the parasagittal groove, whether on one side or both, could be a significant risk factor for developing a condylar fracture. Post-mortem studies also show that linear fissures and fractures starting in the parasagittal groove are associated with significant bone remodeling nearby. This underscores the importance of detecting stress remodeling in the parasagittal groove and how PET could be used to prevent fractures in horses prone to this type.
For fractures located outside the parasagittal groove, opportunities for prevention are less clear because uptake in the condyles further from the groove is very common in racehorses. However, the specific location of this uptake might help in risk assessment. In front limbs of racehorses in training, uptake is more common in the medial palmar condyle than the lateral palmar condyle. This difference is supported by post-mortem studies showing more microfractures in the medial condyle of forelimbs.
This increase in microfracture activity correlates with the higher activity seen in the medial condyle on PET in exercising racehorses. It's generally accepted that some degree of microfracture and remodeling is a normal adaptation process in the condyles as they withstand intense training. However, in this study, all 3 horses with non-parasagittal groove fractures in a front lateral condyle had similar or even greater uptake in the lateral palmar condyle compared to the medial one on the opposite limb.
This pattern suggests these horses might have had an unusual stress-load distribution, leading to more remodeling on the lateral side, different from the typical pattern of more medial remodeling. This elevated level of remodeling on the lateral condyle could have made them more likely to fracture the lateral condyle. Therefore, horses with higher uptake in the lateral compared to the medial palmar condyle in a front fetlock might be at increased risk for a non-parasagittal groove lateral condylar fracture.
It's important to note this theory might not apply to hind limbs, as data suggests uptake is more common in the lateral condyle than the medial condyle in exercising thoroughbred hind limbs. This is also supported by post-mortem studies. In this study, all 3 horses with lateral condylar fractures in a hind limb had increased uptake in the lateral condyle with none in the medial. But this is a common pattern in hind limb fetlocks and isn't unique enough to identify increased risk for this specific fracture type. So, assessing fracture risk for non-parasagittal groove fractures in hind limbs appears more challenging.
After surgical repair, horses typically undergo a recovery period and return to training once the fracture has healed radiographically. All horses in this study that returned to training or racing had satisfactory radiographic healing. However, as we mentioned, 2 horses still showed uptake at the fracture site on PET after radiographic clearance. This suggests that basing the recovery timeline solely on X-rays might lead to returning horses to training too soon. The cases where fracture activity resolved initially but then reappeared later suggest re-injury occurred as training intensity increased, and these horses didn't return to their previous performance level.
The fact that most horses with persistent fracture activity on initial follow-up PET did not race successfully, and that 4 horses developed signs of degenerative joint disease and none returned to their prior performance, indicates that activity at the fracture site and developing degenerative changes after surgery are negative indicators for outcome. These findings highlight a significant role for PET in monitoring horses after surgery and suggest that data from these scans can help predict prognosis.
The study also noted that many horses, 12 out of 14, had uptake on the initial PET in the injured fetlock in areas other than the main fracture line. This included signs consistent with stress remodeling in the condyles, changes near the joint, and uptake in the proximal sesamoid bones. These additional lesions weren't identified on the initial standard X-rays.
Of particular note were lesions in the proximal sesamoid bones, which could represent stress remodeling. A recent study linked fractures in these bones to pre-existing lesions. In this study, uptake in a similar area was seen in the injured leg of one horse and the opposite leg of another, undetected by X-rays. The authors suggest this uptake could represent similar stress remodeling and, combined with the condylar fracture, might precede more severe fetlock injuries. These cases show that additional problems are common with condylar fractures and may not be visible on standard X-rays. These other issues could significantly impact the rehabilitation process and outcome.
The authors do acknowledge some limitations to their study, including the lack of detailed structural imaging beyond the initial and clearance X-rays, such as serial X-rays or CT scans, which would have provided valuable context, especially for the horses that develop signs of degenerative joint disease. The study also had a small sample size and inconsistent timing for the follow-up PET scans, and some horses were lost to follow-up.
Despite these limitations, the study's results demonstrate that PET using F18 sodium fluoride has a relevant role in understanding and managing condylar fractures in racehorses. Assessing the associated pathology provides valuable insight into how these fractures develop. This knowledge could potentially be used for assessing fracture risk and preventing fractures. Furthermore, when used for monitoring healing after surgery, PET could be a powerful tool to guide rehabilitation programs and quickly identify degenerative changes that lead to poor outcomes.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.